Subscribe to our channel and click the bell icon.
Hi, this is Dr. Rajya Lakshmi, and today I'm going to explain you about diet and IVF. So, how are these both related? Your IVF, your fertilization, and your diet. To start with everything, a healthy body is a must for a fertility rate, success rate. So, if you are on that journey of an IVF, first thing is you should need to know that it is a process where your embryo is developed outside your body and then implanted within yours, so that you are pregnant on a biological account. The thing is, once the embryo is implanted, your body should be healthiest at that stage to take the embryo and to make the fetus grow properly without any defects. So to this process, we need to make simple lifestyle changes and also make sure that you take a proper diet to maintain a healthy body. So coming to your IVF cycles, it starts 2 months prior to your implantation. So 2 months prior, you should make your body fit enough that it is at the healthiest state to take whatever medications that you are given and also to take the responsibility of being a to-be mother. So to make a diet or to take a diet which is very healthy enough, you need to make a little differences in whatever daily diet you're taking. It's not a huge difference, just simple differences and simple changes are sufficient. These we call as the lifestyle changes. Lifestyle changes is diet and exercise both together. And coming to the exercise, simple like walking or a yoga or a pranayama would be sufficient for you. And coming to the diet, all we know is we take food either in a breakfast, lunch, dinner, and in between as snacks. The main thing we need to be concerned here is we need to include all the 5 food groups. As we say 5 food groups, it is cereals, as we take in rice, wheat, millets, whatever it is, you need a cereal. You need a pulse or a protein source. You need your vegetables, you need your fruits, and also you need your oils, fats, and dairy. So all these 5 are the essential sources to give you a healthy diet. So how much you need to take, what to exclude and what to include, I'll be telling you today, so that it will be easier for you to frame a diet and follow it accordingly. So first, coming to rice or the cereals. So when it comes to a cereal, always go for a whole grain. Whole grain in the sense unpolished rice or unpolished wheat, unpolished millet, whichever it is, whichever you want to take. Make sure that it is unpolished. Whether you wanted to have it as a roti, whether you wanted to have it as a rice, depends upon your option and your requirement. So first thing, it is the whole grain that you take. Whether you take it as a pasta or a bread also is okay. And coming to the non-veg, your protein. Your protein comes from the non-vegetarian sources such as fish, chicken, eggs, or meat, any red meat, or else even dal, legumes, beans. All these are the protein sources. So the best protein source if you're planning for an IVF would be the seafood, because there are many researches that have been done that seafood increases the fertility rate. So seafood, like you can have fish, you can have prawns, you can have crabs. So at least twice or thrice a week, if you're having a seafood, that increases your fertility rate. So make sure you're having a seafood but not completely fried or completely blended with oil. Make it a healthiest version of it. But compulsorily you can have a seafood. If you're a vegetarian, then go for the dal, rajma, beans, and other sources of protein. So what do we need to take in a pro-fertility diet? That is what we call, before you enter your fertility treatment, we call it as a pro-fertility diet. The first thing is you need to take more of folic acid supplements, because folic acid is a B complex vitamin which is required to have a healthy baby without any defects. So it helps in formation of the spine and the nerves of a baby. So this folic acid is as much important for you before your pregnancy and after your pregnancy also. So make sure you're taking enough of your protein folic acid supplements. If not through your food, it as a medicine, because your doctor will be prescribing you folic acid supplements in a compulsion basis. So through food, if you want to get a folic acids, green leafy vegetables, citrus fruits and whole grains are the best sources we get from that. The other thing is the calcium. So calcium is required for your bone growth, required for the baby's bone growth and teeth also. So suppose you're pregnant or unpregnant, you're not taking enough of calcium. Your baby's calcium needs is derived from your own storage of calcium which is in your bones. So your bones will get depleted of the calcium and that goes to the baby, making you weak. So you need to take more of calcium also. The same way iron. Iron is required for the hemoglobin to be on its peak, that is more than 13. Your hemoglobin should be more than 13, and that we need because the baby needs a lot of oxygen. You will be needing a lot of oxygen. So this oxygen is distributed to your body, the cells and tissues of your body through the hemoglobin. So the hemoglobin binds the oxygen and it's supplied to your body. So if you want more oxygen to be supplied, more energetic and more healthy you want it to be, you need to take more of iron also. So the iron sources which you get iron is a green leafy vegetable, the colored fruits and vegetables that you have like the capsicums, the mangoes, any yellow fruits, the papayas, all these have a lot of iron in it. And also the basic, if you're a non-vegetarian, basic non-vegetarian, meat, that is a liver, mutton liver or simple chicken liver also has a nice quantity of iron to it. The other thing is protein. Protein helps your tissues to grow. So that is required during your fertility period. So if you're going for a protein, go for a whole protein like an egg or a chicken or a mutton, whichever. If you can cut down on the red meat, is as better rather than going for a lean meat like a fish and a chicken is the best option. And rajma, paneer and also dals are also good sources of protein. So make all the protein available to your body. And here I have told you about food, what foods to eat. Now I am telling you what foods you need to avoid. So there are certain foods that you need to avoid, especially the processed and the packaged foods. Processed in the sense that doesn't have any sort of vitamins and minerals to it. Rather, they'll give you more of unnecessary fat and unnecessary health issues. So packaged food is the biscuits, anything which is packed. Your biscuits, your chips, your fast foods, your junk foods, all this comes under the packaged foods. So avoid the packaged foods. Avoid the processed foods. Whichever foods that are processed, like the wheat is processed into maida, the corns are processed into cornstarch. So whatever it is processed, cut down on it and take the healthier version of it. The other thing is avoid fruits and vegetables which have pesticides in it. Rather go for the organic versions which are good, because pesticides residues, even though you wash it with the plain water, doesn't go off. Otherwise, if that isn't available, make sure you're washing your fruits and vegetables in a vinegar water. That is 8 parts of water and 1 part of vinegar. Mix it and wash your vegetables and fruits to it so that there is no residues left. Keep yourself away from all the chemicals, pollutants and processed packaged foods. That will keep you healthy. And other thing is, practice yoga and pranayama, which increases your lung capacity and it is also necessary for the baby to be born. Coming to fruits and vegetables. Pineapple helps you a lot before fertilization. It actually has a lot of vitamin C to it, and also it has enzymes which helps your fertilization process become easier. So if possible, take a small quantity or a cup of pineapple every day or at least 2 to 3 times a week, so that it will become easier for you. The next is dairy. Dairy, we all have the milk, yogurt, buttermilk, different sources of dairy. So when you're choosing your dairy, make sure it doesn't have a lot of fat to it. So take a lesser version, like 3% of fat to 5% of fat is okay, but not too much of fat in it. The next is limit yourself from teas and coffees. 1 cup of coffee or 1 cup of tea is okay, but if you avoid it, it's completely fine. Don't push yourself to more caffeine so that it would contribute to more iron loss in your body. Avoid alcohol and avoid certain fishes. As I said, seafood is good, but there are certain fishes in which the mercury levels are more. So if you see fishes such as predatory fishes like the shark, mackerel, tuna, these three have a higher range of mercury levels, that's the toxin. So avoid these 3 varieties. The rest of the fishes are safe to eat. And unpasteurized foods. Today we get milk. Today we get a lot of vegetables which are unpasteurized, frozen. So don't choose those. Choose the fresher ones. Go for pasteurized milk or pasteurized cheese or any sort of mayonnaise that you use. Make sure it is unpasteurized. Don't take raw foods. Take steamed or boiled foods or cooked foods are good. But raw foods, say a no until your full fertilization process is finished. And coming to a healthy diet, take small and frequent meals rather than taking a whole meal at a time. Don't push yourself eating too much because you don't need twice as much as food to become pregnant or to increase your fertility rate or to go through your pregnancy. All you need is just the right amount of food, which gives you around 2000 calories per day. Distribute it into 5 to 6 meals every day. Breakfast, a snack, lunch, again a snack and a dinner. 5 to 6 meals are sufficient, and all you need to do is eat freshly home cooked food. Don't eat outside, and you need to remain safe and secure when it comes to your diet and health. So here we can go with the eggs. 1 egg a day is good because it has a lot of vitamin A, iron and also protein. So if you don't want to have egg, make sure you're taking soya or at least tofu. Tofu is a sort of paneer made from the soya milk. That's also very good in protein. Or at least a rajma or dal, chana. That is also very good. Boiled and steamed chana are also very good. So either of the options are safe for you. And the other one is, we have certain misconceptions during pregnancy. That is like you have a lot of taboos, like we shouldn't be eating this, we shouldn't be eating that, this doesn't lead to pregnancy, or this actually gives us a failure. Make sure there are no taboos like that. Only thing is, your healthy food is very important. Stick to the prescription, whatever your doctor told you, whatever doctor tells you to follow. That will be safe and good. And make sure you are taking enough of all the vitamins and minerals at a time. Basically, 2 fruits every day, at least 1 cup of vegetable curry, 1 cup of dal or a non-vegetarian curry, 2 serves of rice, roti or any sort of cereal. Millet also is fine, any sort of cereal per meal. 2 large meals at your lunch and dinner. Your breakfast should be the heaviest of all of these. Breakfast, if you are having it, divide your plate into 4 parts. 2 parts should be your vegetable and fruit. Half a part, 1/4 will be your roti or a chawal or whatever cereal. The other 1/4 will be your protein and 1 glass of dairy. That will be a complete meal for you, and you don't need to take anything apart from that. The thing is, be stress free and eat food as you like it. If you like it spicy also, that's no issue. You can have it. But oil is only 2 spoons per day, not more than that. 2 teaspoons per day. And if you wanted to go for a ghee or a butter, it is not advisable for you to go on a daily basis. Choose only unsaturated fats, not the saturated ones. See, unsaturated fats is olive oil. You go for the sesame oil, you can go for a groundnut oil, or you can even go with normal cooking sunflower oil. But avoid coconut oil, lard, that is the fat that is extracted from animals, and also make sure you're not taking much of ghee, butter, mayonnaise, cheese and all. Limit that. Make sure you're having a healthiest oil all throughout your lifetime. I'm not saying just because of this fertilization. This can carry on to later of your life also, which gives you a good health. And half a liter of oil or of fat per month is the limit fee. So I think you'll be having different queries regarding this. So you can meet us personally also. I think that's better. Any queries, you can just give us a phone call and you can get back to us. Thank you.